This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, from Philadelphia to Erie and from Pittsburgh to Scranton. It's Behind the Headlines. I'm Charlie Greenewalt, Senior Fellow for the Susquehanna Valley Center for Public Policy, and I'm joined as usual by my co-host Maura Donnelly. Maura,
yes.
It is the holiday season is upon us,
It
and
is.
I just wondered, how far are you in holiday shopping?
Well,
Are you done with that yet?
Mentally, I'm finished shopping.
Mentally?
Mentally. That means I have my list done, but the rest still have a ways to go.
Do you have a tree up? Or do you put a tree up?
I do put a tree up. I do. I love decorating.
Well, I told my brother that he was the first one that I bought a gift for.
Oh, wow.
So that he would feel compelled to go and have some reciprocity here.
It's always good to give people a heads up.
Yeah. Well, today we're very lucky in this holiday season to have with us a very special guest and a very valued friend, and that is Andy Carter, the president and CEO of the Hospital and Healthsystem Association of Pennsylvania. Andy, welcome back to the show.
Thank you, Charlie. Thank
Hi,
you,
Andy.
Maura. Hello.
I'm going to throw the first question to Maura for you.
Well, we haven't seen you really since the election, so I wanted to just take a moment. We have some pretty big issues to talk about today, but we haven't had a chance to see you and grill you about the election and the impact that it might have on healthcare in general. I mean, it was unprecedented. It was unexpected. There's a whole different slew of names you can use for the presidential election. But what do you see? What do you think might happen with healthcare with the new president?
Great question. Healthcare really wasn't front and center during much of the campaign. But since the election and with President-elect Trump beginning to reach out to policymakers and stakeholders.
It's even weird to say that still, isn't it? President-elect Trump.
Indeed. Well,
sorry.
he's already signaling a strong interest in fulfilling his promises to repeal and replace the Affordable Care Act. But he's also said that he's interested in preserving coverage, and he's interested in strengthening the nation's infrastructure, including hospitals. So as you might imagine, since Election Day, we've been working very hard to develop plans to help the new administration honor those commitments, to find ways to, if Congress and the administration choose to repeal and replace the Affordable Care Act, we want to be there at the table working with them to help them understand the consequences and ways to achieve their policy goals that align with goals that we've been pursuing for several years now. Coverage, access to coverage, affordable coverage, good quality health care, and access to doctors and nurses. I think those are things we can all agree on.
Absolutely. So it's going to be interesting 2017, isn't it?
Yeah, absolutely.
Yeah.
I'm working very hard on it.
Yeah.
Well, something we've spoke with you before, and something we spoke with you and other representatives of HAP on the program before, of course, is this opioid epidemic and the abuse of them that we find across the country. And I think it was brought to our attention by HAP that 10 people a day die in Pennsylvania from opioid misuse. Is that continuing? And what is HAP, what is the state doing? Again, other than they've called the special session, of course. The governor called his special session and some legislation has been passed. Are we making progress on combating that, Andy?
We are, and we're doing it in a bipartisan way, which I think should be encouraging to Pennsylvanians because the recent presidential election reminded us of a division between the parties. But in addressing this crisis, and truly 10 people a day dying not just in particular parts of the state, but across the state, in urban and rural communities, has led policymakers to come together, cross party lines, to actually fashion some solutions. And the governor just signed a package of bills to do that. One example is making sure that clinicians, physicians, nurses, and others are checking a state database before they prescribe more opioids to make sure someone isn't doctor shopping.
It's long
to build a
overdue, I
supply.
think, isn't it?
It's long overdue. But we also have...
How long will it take to set that up? I'm sorry.
It's underway now.
It's underway. Oh,
so
that's good news.
we will begin seeing the benefits of stricter controls of opioids very, very soon. It'll take longer to see the benefits of some of the education strategies that we need to pursue. For example, requiring that medical students be educated on the risks of opioid prescribing. That's a very important part of the legislative package. And then we have to continue spreading the word to other physicians that are already practicing about how to appropriately prescribe for pain. And that's where it all starts and why it cuts across so many people. Lots of people of all kinds of socioeconomic status need pain management, and many times the pain management strategies have been a little too aggressive in the use of some of these very potent medications. So we want to work with all the prescribers to make sure they're up to date on best practice.
Well, so it's probably a little bit too soon to see any benefit to this program. So hopefully when we have you back in the new year, we'll be able to update some of those numbers, and the deaths will have diminished, hopefully.
Absolutely, and I really want to thank the governor and the legislature for working very swiftly to get complex work
That's very
done.
unusual, so that really is, that's really wonderful.
Very well put, Maura.
Yeah, so that's really, really great news. So let me ask you, before we move on to a couple of other issues, just for our viewers, if they have a family member that they think is having some issues and they're very concerned about them, what would you recommend that they do? Who should they reach out to?
You know, you should always start with a difficult conversation like that with a trusted family physician who can help you understand the risks of addiction, to help you spot the signs in your family members. So that's a good place to start. You can then also begin turning to public resources that will be available to guide people to the right place. The Department of Health is an excellent resource. Certainly, if you find yourself in a crisis situation, hospital staff and the emergency departments and in our outpatient departments are in a position to help give patients and families guidance on how to address and tackle addictions.
Oh, that's great information. Thank you.
In the past, Andy, we've spoken about the Interstate Medical Licensure Compact. Can you update our viewers on the progress of this, and could you tell us again what it is and how it will benefit the people of Pennsylvania?
Well, the first thing it is another strong example of bipartisanship in Pennsylvania. We have a situation where we have a lot more people enjoying insurance coverage, over 1 million people.
And that's because of?
The Affordable Care
Okay.
Act. So 1 million more people with coverage. We also have a huge number of people turning 65. Over the next 5 years, we'll have another 500,000 people turning 65. And at that age, we start to begin using more and more health care. So we have a shortage of clinical professionals, including physicians and advanced practice nurses.
We have a very
and others.
rural state as well.
And a very rural
very
state.
rural.
So
yeah.
how do we tackle that? One of the great ways it's cost effective is to be able to use telehealth and to have access to physicians in other states via telehealth technology. And for those physicians out of state to be able to provide medical care over phone lines and computer lines, their medical license has to be recognized here in Pennsylvania. It's just like a driver's license. We can legally drive in other states thanks to the recognition of the Pennsylvania driver's license. Pennsylvania is now the 18th state to recognize the medical licenses issued by other states. So it'll support telehealth. It'll also make it easier for physicians to come to Pennsylvania and have their training and experience and license recognized to provide healthcare services here. So it's a quick way to expand capacity for rural and urban settings alike, and make sure that all these folks that need care can have access to it.
How do doctors like it?
I
think patients would love it, but how are they embracing it?
I think physicians, it's a complex range of thinking on the issue. There was concern around whether or not other states had the same standards that Pennsylvania does. We've been able to reassure folks that any physician who comes here to practice has to meet the same standards of practice here that they would anywhere else. So that's helped. Many physicians see it as an opportunity to interact with specialists that they might not otherwise have access to in other states. So I'd say net, there's been support.
Good.
With 1 million extra people being covered, Andy, have our health systems, have our hospitals been overtaxed or been stressed by this addition?
I think instead of overtaxed, I'd say they are continuing to do what they've always done, which is provide care to people who seek care. With the insurance coverage that people enjoy now, it means that services that we used to provide for free to people who are eligible, we are now being reimbursed for. But there's no question that with more people enjoying insurance, they are pursuing health care that they were probably deferring. And so we're rising to meet the demand without question. Many of our members are constructing new facilities out in communities to make it easier for folks to get care and to increase capacity. We're definitely increasing capacity, as you suggest, Charlie.
Okay, good.
Well, one of the, I'm always I'm probably a physician's worst nightmare because I Google everything before I go in. I think everybody does that now. But I'm really big on trying to, I'm not a fan of doctors and hospitals like most people, so I want to be healthy. So I've been looking at your Healthy Me PA. So can you tell us a little bit about that? Because I think everybody should be doing that.
Well, Healthy Me PA is part of us saying just the opposite. Us saying we want you to be very active. Come to medical appointments as well informed.
Oh, I agree with that. Yeah, I'm trying to avoid the crisis hospital visits.
Oh, yeah,
that sort of thing.
And we appreciate that
Yeah.
because if you can take care of a problem when it first emerges, it'll be safer and less costly
Right.
to deal with it. We created Healthy Me PA back in May of this year for one main purpose: to engage Pennsylvanians in strategies for staying healthy, recovering from illness, avoiding habits and behaviors that undermine your own health. And it's a community that's already grown to over 70,000 people who can sign up through Facebook or Twitter or our website and get tips on healthy lifestyles, great recipes and eating, but also start learning about how to navigate this increasingly complicated health system. We have resources available to help people figure out how deductibles work, how co-payments work, how to find out how much a procedure might cost. We're sharing with them ideas of places they can go to begin to navigate this system. And the response in only 6 months to have this many people is very encouraging. And a literate public on healthcare issues is going to help us reduce costs long term, and we're going to have a much healthier population in Pennsylvania.
This sounds like it would be a good resource for us for our New Year's resolutions, Charlie.
Mine is always
for
to lose
everybody.
weight.
It's coming up on that time of year too, so we should direct everybody to Healthy Me PA.
I know, we should. Well, Andy, in the last minute of the show, could you please tell our viewers what HAP's major initiative might be at the state level next year?
With working with the legislature and the governor, we'd like to see an even better environment for telehealth. We need legislation to make sure that it's regulated properly and that it's paid for uniformly across the state.
Okay, well that's a
great initiative.
Yes,
Yeah.
yes indeed. And with that, we want to thank you for coming again, and we want to wish you and all the folks at happy holidays and a happy new year. Maura and I are always glad to see you, and we hope to see you right after this.
Behind the Headlines is brought to you as a public service by the Hospital and Healthsystem Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Chamber of Business and Industry. The Pennsylvania Chamber serves as the frontline advocate for business on Pennsylvania's Capitol Hill by influencing the legislative, regulatory, and judicial branches of state government. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeanne Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by Daily Express, transporting construction, farm, and industrial equipment throughout the United States, and by Blackford Ventures, LLC, a private equity firm seeking to make significant investments in real estate, proven business enterprises, and their leaders. Find out more at www.blackfordventures.com. And by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Hi, welcome back to Behind the Headlines. Maura, we just were talking to Andy Carter about the state health issues regarding Pennsylvania, and certainly one of those issues has been and continues to be childhood obesity.
Absolutely. It's very costly, and it's just a tough situation.
Yeah. And we're fortunate enough on this particular segment to be joined by someone who's doing something about it.
We do.
We're joined by Jeanne Arnold. Yeah. Jeanne, welcome to the show.
Thank you.
We're very happy to have you. You are one of the nation's leading and one of the state's leading philanthropists. You are one of the state's leading health professionals, and you've had a lifetime of experience with health issues. I wondered if you could introduce yourself to our viewers for a minute and tell us a little bit about your background, because you've spent your whole life dealing with health issues.
Well, I'm a registered nurse, and I graduated from Rhode Island Hospital. I won't tell you what year. But anyway, I graduated, and that was a diploma program, and then went on to get my baccalaureate degree, but I still did bedside nursing, even though I started to go on the administrative track.
We are so fortunate to have you in Pennsylvania right now. So tell us a little bit about what you've been doing here in the state, what you've been doing for the state, and what your current interests are.
Okay. Well, I'm on the National Executive Board of the Boy Scouts of America. And when I joined the board, I was the only woman. Now, we do have another woman now. Dr. Robert Gates, who is our retired Secretary of Defense, asked me to be on the board, and then asked me also to lead a task force on childhood obesity. We've got a really significant problem with obesity in our country, and the statistics are very, very scary. 71% of the kids today do not qualify for the military, either because of criminal background, not graduating on time. If they do graduate, they can't pass the exam, and basically physical activity. Oh. So I was given this assignment, and in looking at what I was doing, it can't just be the Boy Scouts. It's got to be a community, because the boy may come to a Boy Scout meeting and everything's being done, by the book, but then they go home and mom pulls up to a McDonald's. So what I'm doing now is trying to focus this on a community base, bringing as many organizations together to begin to share what they're doing, because everybody's doing something. And if you look at any of the community assessment needs, whether it's Derry Township or Lebanon or Lancaster, obesity is one of the top problems.
Oh, wow. Mm-hmm. So is this a new initiative, brand new initiative? I mean, how far along are you, and what's the progress being made so far?
Well, when I was at Good Samaritan Hospital, we did a community needs assessment. And from that, I'm going back into the early 90s, and from that, I was responsible to develop some kind of a committee structure to address what that community needs told us, whether it was senior problems, youth, maternity, just everything. So I put together task forces to work on all these problems, and that has rolled up into the Lebanon Community Health Council, which still is meeting, and I'm on that board now. And what I've done is basically take this project with the Boy Scouts on a community level.
So is your goal to replicate that in other communities as well,
yes.
This type of program?
Yes. Now, the Boy Scouts were the thought leaders in this, in giving me this assignment, which is really a big assignment. But I want to extend it to all youth-serving organizations and to parents and, whatever, because they are significant problems.
Well, this is such a significant chapter in the Boy Scouts history. First of all, you're the first woman who's ever sat on the governing board for the Boy Scouts of America, and then they saw your background as a health professional in Ephrata, in Lebanon, in Hershey, and you sit on the Hershey
Medical Board.
The board for the Hershey Medical Center.
Yeah.
And so you had that background, so you were the perfect person for Secretary Gates to to pick to lead this effort of the Boy Scouts. Now, this effort has a name. It's called Compass.
Compass.
What does Compass stand for, Jeanne?
Well, to me, it stands for pointing us in the right direction. You know, you need a compass to get around, but we're working on that to have some kind of a logo that would be specifically for this.
Okay.
So,
but it's interesting to me when I researched it a little bit, because Compass, it's not just about obesity among the Boy Scouts and among the young people in the country, but there's 3 prongs to it. Could you talk about the other 2 prongs? It's obesity and
education and
right?
morals, exactly. Yeah. Oh,
so
with
you're getting
mission
at
readiness.
values and education and obesity simultaneously.
Right.
Yes.
Right.
Trying to bring them all together. Now, you, in order to do this, you've been traveling all over the country. You've been to California, to San Diego. You've been to Baton Rouge.
Yes.
You've been to Texas, meeting with organizations and universities all over the country. You've been to Massachusetts to bring Tufts in. Could you tell us some of the other organizations that you have convinced to join this initiative, Jeanne?
Okay. We basically have Pro Wellness from the Hershey Medical Center, and they're really helping me to move this forward. We have Tufts University. I also found out the Boy Scouts already have a number of programs, which nobody told me about. You know, I just went off on my own, and but there are a lot of initiatives that are in place. What we need to do, rather than layering another program on top of all this, is to see how we can coordinate it, not only with the Boy Scouts. I went to Pennington in Baton Rouge, and they're the leaders in childhood obesity. So I was down there just to see some of the things they're doing.
And I never knew that until you told me about this initiative, and I did some research, and then I talked to a friend in Baton Rouge, and when I said that you were visiting, he said, well, of course she's at Pennington. And they're very proud of what they've been able to accomplish there.
Absolutely, absolutely.
What kind of reception did you have at LSU?
Oh, it was very nice. It really was. And then Dr. Cephalou, who is their president, he invited a lot of legislators to come afterwards. So we were treated very, very well.
Now, when you were in San Diego, you delivered a keynote speech. Now, could you tell us a little bit about the background for that and what you were doing there?
Basically, I started to present my program and what I want to see and what the vision is, which is basically trying to coordinate and implement a program that can be transferable to other communities. And so it was probably about an hour presentation with questions, and got a lot of really good feedback for that. So I gave the presentation. Dr. Gates was there, and a number of the Boy Scouts were there as well. So I've given this presentation many, many times, but and I'll share the information too, because I think it's really important. We're talking about health consequences with obesity, whether it would be cardiac, diabetes. There's so many things that can stem off of that basic problem.
So if a young man is joining the Boy Scouts, and maybe it's premature to ask this question, but what can he expect programmatically regarding this issue? Is there going to be a new badge for it, or I'm joking, but what will be the sort of the impact on the actual Boy Scout with this program?
We're talking again about Compass, and we haven't really gotten there yet. But my idea would be there would be the Compass, and then you'd have north, south, east, west, and the boys would have to do something in all those areas to get the entire badge. But that's in the development.
They would get a badge. Oh, I was just joking. Okay, well that makes sense. That's what they work towards. So
that's right.
So this program will result in a badge for a Boy Scout if they complete. Okay.
Now what they're doing in their troop meetings is they're serving water instead of soft drinks.
Oh, that's good.
Yeah, and fruits and vegetables rather than snacks, and then 15 minutes of exercise. Okay.
So there is an actual boots on the ground, consequence of the work you're doing for these young boys. Okay.
That's right.
That's a great change for those troop meetings.
Now, you're
that's
meeting
great.
with nonprofits as well, Jeanne. I believe that you've been working with the Salvation Army of America as well to bring them into this effort. How has that gone?
Oh, the Salvation Army, particularly here in Harrisburg, is doing phenomenal things with the children with obesity, because we really have to tackle the problem before they get to be Boy Scouts. You know, it's the younger ones, and they've been terrific. They've shared their information, and I went and visited the kids, and probably shouldn't say kids, but the children.
Okay. Yeah.
And I'm very proud of what they've done. As I said, they shared all their information, which I've been able to disseminate to other organizations. So I've probably met with 20 or 30 organizations, one being the American Heart Association, who through Bayer was able to establish gardens in the Lebanon community at Elko and Ebenezer. And the kids actually do the planting, and then they watch their gardens. And Bayer's given $25,000 for both of those schools.
Wow.
Yeah, it's significant.
Well, in the last 30 seconds of our program today, Jeanne, you've not only worked around Pennsylvania and around the nation, but you've worked around the globe on this. Through the Boy Scouts, you've met one of the biggest supporters of the Boy Scouts in the world, who happens to be the King of Sweden, who's become one of your best friends.
I enjoy him so much.
And he supports this anti-obesity effort as well.
Absolutely.
And so they're putting this into place in Sweden as well.
That's right. And
Going
it will
global already.
Yeah, global.
Well, we will look for you to come back when you're further along and give us an update.
That'd be
And
great.
I want to thank you for all your efforts on behalf of the nation's youth.
Thank you.
So stick with us. Next week, we'll be back with a new segment of Behind the Headlines. You can see us on YouTube and on Voice of PA as well. We'll see you again next time.